With today's Focus on Your Health, Teresa Snow explains how a complex surgery helped solve a serious complication from acid reflux.
Focus on Your Health is sponsored by MU Healthcare.
Men are about 3 times more likely than women to develop esophageal cancer, a cancer that occurs in the esophagus, the long hollow tube that moves food from your throat to your stomach. David Heimers is used to pushing himself on the pickleball court and sometimes pushing through discomfort.
I've had acid reflux for decades. I thought it was a nuisance that I had to live with.
I got it.
But this active 70-year-old didn't know his acid reflux was burning the inner lining of his esophagus, putting him at risk for cancer.
The esophagus is not used to the acid because that belongs into the stomach. And then over many years that can cause a change of the lining so that the esophageal lining doesn't look like esophagus anymore.
At University of Missouri Healthcare's Ellis-Fischel Cancer Center, doctors found a tumor where David's esophagus entered his stomach. Esophageal cancer is rare, making up just 1% of all cancers diagnosed in the U.S. But physicians at MU Healthcare treat several dozen cases each year. Dr. Jussuf Kaifi performed the complex surgery.
We remove the whole esophagus and make a tube out of the stomach to make a new esophagus. And the stomach will pull up into the neck and connect it in the neck.
Stretching his stomach into his chest to form his new esophagus. David used a tube-feeding pump at first, but slowly he began to eat.
It was probably 8 or 9 months before I could eat a whole hamburger.
Today, David says life has mostly returned to normal.
I'm really happy where I'm at compared to what the potential was. You know, I'm happy to be here.
Good game.
And he's ready to work up an appetite on the court.
All right.
Joining me now is Dr. Jussuf Kaifi, a cardiothoracic surgeon here at MU Healthcare. When the stomach is used to create that new esophagus, it probably radically changes eating habits. Tell me about that.
In the beginning, this is a major change for patients. They have to eat 6 meals a day, smaller portions, but after a year, they can really eat pretty normal again.
That's good news. So what should we be concerned about? What are the risk factors?
The major risk factor used to be smoking in conjunction with alcohol consumption. This has really changed towards heartburn now, which is acid reflux. So if you have persistent acid reflux and heartburn and it doesn't get better with medication, you should see your primary care physician.
Tell me how you manage a patient's care along with their community physician here at MU Healthcare.
We like to work very closely with the community physicians. We have a strong multidisciplinary team. We discuss every patient here, but then we give recommendations to the community so that everybody can get the treatment close to home. The major surgeries we like to do here at MU Healthcare.
Okay, thank you very much, Dr. Jussuf Kaifi. And with Focus on Your Health, I'm Teresa Snow.
Focus on Your Health has been sponsored by MU Healthcare.